KTN News. Get the whole story.
When he started Avenue Healthcare, he was both the doctor and the driver. With a nurse, he went into different companies within Nairobi looking at solving two problems: affordability and access to healthcare services. Many years later, Dr. Amit Thakker has gone continental trying to make a difference in Africa's healthcare. My name is Dr. Mercy Korir, and this is Doctor's Diary, the story of realizing a passion to achieve more.
I thought of a van because it keeps the cost down. You don't have to have rental spaces which you're not using through the week or even at night. With the van, it's the same infrastructure moving from company to company, from premises to premises. And it reduces your transport costs as well, and infrastructure costs, and that was passed on to the patient. And so for about, I remember when we started, I used to charge 5,900 shillings, just below $600 for an unlimited outpatient cover that would give you consultations plus unlimited drugs, dressings, and there was a capitation model by then, 95, 96. I'm delighted that NHIF is now using such a model because they want to capitate the medical providers and transfer the risk to the doctors, and it's a very nice model.
But Dr. Thakker did not set out to medical school with a plan that he would be a mobile doctor driving a modified van from one corner of industrial area to the next. It was his internship at the Kenyatta National Hospital that he says was a major turning point in his career.
Midway of my internship year, I realized that affordable healthcare in Nairobi was literally absent. There were many of my friends whose staff were being admitted, and I used to tell them about the waiting times in Kenyatta. You know how it is, people have to wait for surgery, or they have to wait for getting the lab results. I made one or two phone calls, and they immediately told me, are you asking me to move them to Nairobi Hospital? And the costs just across the road were startling. There was a major difference. And I realized that affordable healthcare in Nairobi was literally was not available. So my career began immediately after internship. I established a company called Avenue Healthcare in 95 with an idea of taking healthcare to the people, especially the people working in factories, the people working on the shop floor, or to bring affordable corporate healthcare. I started with a van, which I bought at 95,000 shillings, and that was really my investment. I converted the van into a mobile clinic, removed the seats, and started offering a structured mobile clinic services to people in Ruaraka and in industrial area. And that's how my career began. And Avenue Healthcare, first days was that, 2 staff. That's how it began.
His value proposition to the factory and company owners was that he would deliver healthcare services right at their doorsteps and take care of work-related injuries and minor ailments that their staff need not lose a whole day's wage in search of a healthcare provider.
The van had a couch. I had a small cabinet with a bit of pharmaceutical products. And I went to many of these factory owners and large companies that rather than your staff leaving the premises and going to see a doctor, what if I had scheduled visits to your premises? So I was driving with the clinic, and I had a stock of medications, and it was a simple outpatient plan. And many of them liked that. Injuries, bruises, simple URTI, muscle aches and pains, especially with high labor. So I remember my first client was Manson Heart on Babadogo Road. They make tiles, and it's quite a labor-intensive job. So the companies really liked that. Then we got Nakumat, which is a supermarket, and with the supermarket staff, it's very difficult to get time out to go and see a doctor. But imagine if you have scheduled doctor visits coming to you.
Unknown to him at the time, Dr. Thakker had set off a chain of events that would birth Avenue Hospital.
Turning this around made Avenue Healthcare actually position itself very well for success. Then we started offering managed healthcare plans, we started corporate plans, we started in-house clinic, and within a few years we had about 600 corporates that really liked this service, that were looking for a solution. And then we started offering membership plans which covered people for the whole year for in and outpatient. With the volume of patients, I needed to open a clinic in industrial area, then in city center, and Mombasa, Kisumu. Now we have about 18 clinics all over the country with 3 hospitals, one in Kisumu, one in Nairobi, and one in Thika. So that's really how Avenue Healthcare began, with the partners that I had before we made the transaction to a private equity firm.
Dr. Thakker gets amused when he recalls what the naysayers had to say back then. But it is those who believed and joined him who have gone on, though in different capacities, to still advocate for affordable healthcare.
They thought this was the most silly idea and wondered whether such a model would even work. I remember being at my friend's house where we were sticking the vinyl onto the counter so it looks like a nice counter, because I couldn't afford a marble counter. So I was buying the vinyl paper and we were sticking it and making it look like a pharmacy cabinet and putting the Macintosh on the couch. It was a novel idea, so I was suspicious. But there were a few of my friends who thought this is what Nairobi needs. And if we don't try new approaches, you never know. And the best way to test a market is actually send the product to the client.
From as far back as he can recall, Dr. Thakker wanted to be in science, to be a doctor.
From my youth, I always wanted to be a doctor. My grandfather, who's actually a businessman in Mombasa, inspired me. He saw that I have a leaning towards helping people, and I had compassion. And he picked up that I was extremely good in science, and I had a leaning towards that. So he always pushed me towards medicine, and he asked me to explore the field of medicine. That really pushed me to select medicine at the University of Nairobi. So for as long as I know, I always wanted to be a medical doctor.
Though he says his 5 years in medical school at the University of Nairobi was tough, he enjoyed his time in training to be a doctor.
I tell people that if you really want to be a good doctor, you should go and train at the Kenyatta National Hospital. It's a goldmine of patients. It's got different types of patients, and it's extremely challenging for a young student. So I had a very amazing time and learned a lot.
Early on, at the age of 10, Dr. Thakker's life was changed irreversibly when he lost his mother. The third born of 4 and the only boy had to step up and learn to navigate life without a mum.
And my dad never remarried. So it probably created that sense of responsibility. I think that... Are
you the eldest?
I'm the third born. I was the third born, but I was the only boy in the family. So when my father lost his mother, his wife, my mom, at my age of 10, he had to lift the challenge of raising 4 children. I don't know how he did it, by the way. I don't know how, I would not do it. It's crazy. So anyway, he raised 4 kids himself, and he worked. So by the time I was 12 years old, it dawned on to me that responsibility is not negotiable. So I probably must have raced about 10 years in my upbringing. So my childhood was fun till my mom died. Then I was no longer a child. Then I started taking life a little bit more seriously, and probably took on my career, handled the business. So that's the family structure that I have. Then my father passed away when I was 40. So there was about 13 years ago. And so since then I realized that parenthood is not an easy job. There is no manual.
It is this traumatic experience that makes the 53-year-old Thakker view parenthood and specifically motherhood from a different lens. The proud father of two appreciates the presence of his wife in his children's lives, something he never got to fully enjoy.
It changed my personality and my outlook in life. Not only did I think that responsibility index went up and it became a true picture for you to take on responsibility, I probably also became very encouraging to my children on how they should pursue their dreams. I also feel that we became more open with them. I think that's the result of losing my mother early on. And I can be a father, but maybe I can't be a mother. But I was always happy to see my wife giving and showering them with motherly love. And probably I lived the motherly love through watching that engagement. So I'm learning that. Even now, I see that. I have two daughters. Serish is 22 and Alisa is 20. Serish is studying in Los Angeles and Alisa is studying in Vancouver. And my wife Sabira is with me at home.
With a busy schedule following his passion in doing what he enjoys most, in between running a business and bringing up a family, Dr. Thakker tried to be present for his children as much as possible.
During the growth of the business and expansions, there was at home and studying. So the work-life balance is something I always struggled with. Not only then, but even now. So I keep saying that I don't think work and life are opposing forces. So actually I don't like that word of balance. I like to call it work-life harmony. And that harmony, so me doing what I love and my family supporting me in what I love has allowed me to reach and do what I have to do. So I didn't see them as opposing forces. I always saw that as supportive forces. Did I have enough time? I tried to make enough time where possible. I did attend the sports days in school where it was possible. I celebrated in the awards that my daughters won. They are good swimmers and tennis players. So Alisa played tennis and Serish is a great swimmer. So attended their school functions where possible. Obviously, maybe I could have done more, but I think I struck a good balance between work and life, and I still continue to do so.
Dr. Thakker's office is decorated with memorabilia, from being at the cover pages of magazines to trophies and recognition for his service in the health profession. But one stands out.
But when I did win the 1999 Best Male Entrepreneur Award by Rotary International, I realized we're onto something that needs to be spread across the entire country and maybe continent. So by the year 2000, I was fueling up the whole expansion plan. By 2005 and 2008, we were totally aligned with the big cities in Kenya. And then to 2010 onwards, the other counties were going to be serviced. We had directors at different age groups and had different ambitions. And after we created the model of the Avenue Group, we got many partners and private equity interested parties, and the transaction began. And I was happy that within 5 years we had a good transaction on the transfer of the Avenue Group.
With that, he exited Avenue and sold his entire stake.
It was a desire to go beyond Kenya. It was a desire of doing something beyond services. So I found myself in an excellent position to start Africa Health Business. Remember, I always wanted to go continental. So I started in Kenya, and I did want to reach out to the other parts of Africa. I needed to let go in order to divest my interest into the other countries of Africa. I also think it's fair to balance the views of other shareholders in your organization. And it is also a matter of having the right deal. So if you do want to engage in an investor, if the numbers work well, and I thought at that time I really got a good EBITDA multiplier on our business, and the exit was worthwhile if I had a plan in what I wanted to do with the funds.
He now focuses his attention in being a thought leader in healthcare, looking beyond Kenya to the African continent.
There's a bit of altruism in all doctors, I believe. There's that gene. And I think what I can best offer is also my leadership skills. So giving back that through my altruism spirit is what also provides me the satisfaction. Right from being the chairman of Kenya Medical Association and taking over Kenya Healthcare Federation, I've been able to bring private sector in the forefront of our discussions in Kenya. I've also moved the needle of public-private partnership. There has been great engagement. And what really I'm delighted about is the level of trust we've built between government and ourselves. I can tell you, between 95 and 98, when I started Avenue Healthcare, the relationship between public and private sector was so strained. You had an iron door. You couldn't even walk into Afia House. The Ministry for Health was like a no-go zone. Through several years of engagement and starting the Ministerial Stakeholder Forum, working with Kenya Private Sector Alliance as the Health Sector Board, our trust between the public and private sector is enormous. Look what we did during the pandemic. I think it was a result of the years of building relationship with the Ministry of Health that PPP could work in order to save lives and livelihoods. So I like giving back, and I feel that leadership is one of the areas in giving back to the community. Organizing private sector is something that I am delighted to do and something I can offer. Not only in Kenya, I went and founded the East Africa Healthcare Federation in 2012. And then within a few years, we started the West Africa Healthcare Movement. And in 2016, we started creating the Africa Healthcare Federation. Last year, the Africa Healthcare Federation the board was launched. And now I'm leading a board of 10 directors that represent the 5 regions of Africa. And we have now 27 countries who have had or built on the model of KHF to ensure public-private dialogue and partnership is really maintained.
His calling is to see better health systems in Africa that respond to people's needs, no matter their socio-economic status.
Through the work that I do at Africa Health Business, the interest is to ensure that we have deeper investments, stronger private sector, and appropriate partnerships created for improving affordability, equity, for stronger health systems. We are a facilitator and a catalyst. We have a consultancy arm and a capital arm. So I hope to achieve a stronger private sector that reaches more people across the continent. And if the private sector becomes stronger, and we have a dual system in Africa, public and private, you'll find that we'll have a healthier and prosperous continent. There are so many unserved populations, regions that require our services. They require innovation, require us to bridge the geographical barrier and the financial barrier. So through the work at Africa Health Business, we are promoting investments, we are promoting partnerships, and we are promoting greater innovations in healthcare.
I asked him how, especially in Kenya, this will work considering the widespread perception that private healthcare is costly and seems to prioritize profits over people.
I think we have to do more about messaging private healthcare. There's no doubt that the input costs are high. If you buy a stent, if you buy those angio catheters, they are costly. There are some medications that are still costly. We don't even make all the medications here. So obviously those costs have to be transferred to the patient. Don't forget the salaries of our professionals are also pretty high, and that have to be catered for when we are charging fees at private hospital. So you're right. We have to work on bringing the cost down. We have to bring down also the input costs, and we can transfer it to the patient. But truly speaking, there are so many clinics out there in Kenya that are charging affordable rates. They are run by nurses, they're run by clinical officers, even some by doctors. And they are at places where public sector have not even established themselves. So, to be honest, even those who are unable to afford sometimes find funds to just get the right quality of care from the private sector. That's one. The second is quality costs. And if you do want a PET scan and an MRI and CT scans, those are huge capital costs which have to then be recovered through fees and services. So the private sector charges back to the patient. And quality is something that is also resting on the kind of professionals and the doctors and the specialists that you employ. All these combined does have a price. Whereas on the public sector, largely it's subsidized through the exchequer. The treasury pays for all the salaries, the treasury pays for all the supplies, which are the major costs. So you really can't compare the two. And I think competition in the private sector is very healthy. And over years, I have seen that the prices have been coming down in especially the common services like dialysis. I remember it used to be like 25,000 a cycle. Now you can get dialysis for 9,000. Innovation and competition will bring down costs. Let's not forget insurance is also another area that we need our Kenyan population to take extremely seriously, to enroll their families and to enroll their themselves into insurance is going to be extremely useful.
He is hopeful that Africans can get healthcare within the continent without the economies losing this foreign exchange. He believes that the pandemic has been the biggest lesson on medical tourism.
I feel that Kenya, South Africa, Egypt, maybe Nigeria, Ghana, and maybe Morocco, these are some hot spots of where there is innovation and their skills. Remember, one thing that drives patients to other countries is quality of care and cost of care. And India has mastered the mix quite well.
From his experiences living through different iterations as a doctor and seeing his wife, whom he met while in first year of medical school, Dr. Thakker encourages young people to just follow their passions to achieve more in life.
We were together in the same class, but she dropped medicine and went into biochemistry simply because she couldn't stand the anatomy classes and the cadavers, and she didn't think that profession was for her. So she did biochemistry and turned into the banking profession. So she's more a banker, scientist, and now left medicine to me. You've seen so many students mix their careers and passion and find the path, which is another thing. You don't have to end up with what you start. Your start could give you a nice foundation and a base. But if you find your passion in management, or you find your passion in law, or in engineering, or in finance, you can pursue it. And I tell that also to the health workers and the doctors who are watching this show, that you have great opportunities out there. Doesn't mean that if a pediatrician or a gynecologist or a nephrologist who taught you, that's the only specialization you should go for. You don't really need to do only medical sciences. From your undergraduate degree, be it pharmacy, nursing, medicine, there are several other opportunities in management. I mean, I did my MBA.
Dr. Thakker believes that lessons picked along the way as lived experiences or through others have made him realize that the non-financial rewards are more gratifying than monetary rewards. Dr. Masi Korir for KTN News Doctor's Diary.
KTN News.